doctors and healthcare workers who are responding to a global health crisis, trying to protect individuals, families, and communities in adverse situations with stretched resources, shortage of personal protective equipment, and other equipments, have found themselves as unexpected targets in the fight against COVID 19. To make matters worse, there have been several reported incidences of even violence against them during this pandemic time, probably due to fear, anxiety, panic, misinformation, mistrust, and misplaced quotes in the social media. Today, we'll talk to a highly experienced panel of doctors who have seen it all firsthand. Dear utterers, don't forget to like, comment, share, and subscribe to encourage good content. Let's welcome Dr. Auriom Kar, who's a senior consultant, interventional cardiologist at Narayana Hridulaya at Kolkata. He's highly renowned in his field of expertise and is popular for extending exemplary medical assistance to all his patients for a great many number of years now. Next, we have with us Dr. Abhishek Nandi. He's a consultant pediatric orthopedic and bone tumor surgeon with Bhagirathi Neotia Women and Childcare Center at Kolkata. He is also highly experienced and provides care and services to children with immense determination. So let's open the discussion. Abhishek, pandemics always come up with various life threatening issues. Tell us, how have you all been reacting to highly stressful situations or handling your fears of exposing your families to the pandemic?
So Lumbini, the pandemic which we are at this moment going through is once in a while. Okay. So previous pandemic like this was, I think, was the bubonic plague pandemic, but we all were not there.
Right.
So this COVID-19 situation came to us as a shock, as a surprise, and it hit us because the virus was absolutely new. Okay. We used to read about this coronavirus in our textbook of microbiology.
Mhm.
It was maximum one paragraph.
Okay.
So we don't know how it comes. We don't know how it infects. We don't know what are the complications, how it will be affecting the patients, what are its infectivity rate, and on top of it, if it is getting infected, if we all are getting infected, how to treat. And on top of it, the SARS coronavirus has got a tremendous infectivity rate. So within 1 year, I think it has infected around 6 crores and killed almost 16 lakhs. That was the data I got in my WhatsApp group. So stressful, yes, stressful, because we don't know how it will behave. We were afraid because yes, we might get the infection, but at the same time, we cannot leave our patients. So we don't know. We were all very afraid. We don't know what to do. When we used to go to our hospital, everything started when I was in CMC Vellore. So my personal experience in CMC Vellore was that it was very crowded. It is a very crowded hospital. So we used to get exposed to a lot of patients. Okay, sometimes we are wearing just a mask, sometimes N95. Many a time it happened that we were not having enough PPE because people who were directly contact with this COVID virus, they required it. So we had to give it to them because there is this 6 hours duration. That is the maximum which we can use a PPE. So what in family, yes, when we used to come, I was kept in isolation. So my mother, father, it was a strict instruction to my mother and father that when I come, please, you are not supposed to come in close contact to me. And that was officially written as around 6 feet, but I used to maintain at least one room distance. So when I used to come in night, suppose after giving duties and all, so I used to say to my mother and father not to come close to me in my room. My wife, yes, she used to be with me, but my mother and father definitely no. And it was a terrible situation. because I used to read in newspaper, though it had not happened to me personally, that in societies there are doctors who are not people are not letting them into their apartments because of the fear of infection. One terrible situation happens. One of my colleague in Kolkata, he lost his father for due to COVID. He was also an orthopedic surgeon. So when he finally came home after from the hospital, the apartment people, they gave a message in their WhatsApp group telling that you are not allowed. You have to stay outside in hotel. So these were the situations which we have to go. We were going. Things were a little different. Means we were not expecting the same treatment uh, like that before. But again, everyone were concerned about their family, so we cannot complain also. So this was the thing. So it was very. It is now the infection rate has come down definitely. So things are little going towards a better situation. But again, the thing which we faced was very stressful and very new to us, and especially when we are just starting in a career to face
Mm,
such kind of thing,
mm,
then a question always comes in mind that why are we doing it?
right,
Okay, why can't we sit at home and we give some video consultation, work from
right,
home and all those
right.
things? Why can't we do it? But again, we have to go. We have to go. So the things which we did, we stopped operating elective cases. So cases which can be deferred for some 3 for 4 months, we used to defer. But emergency cases we used to do. If we are getting a COVID result, is fine. If we are not getting a COVID result, we used to treat it as COVID positive, and we used to go. Sometimes it happened, many a time it happens that some other case is going in COVID theater, so we are not getting um, full protective gear and all, but we have to go and we have to go in with the surgery. So it had happened some 1 or 2 occasions when we don't know the results whether it is COVID positive or not, but we went ahead with our surgery. Finally it came out to be a COVID positive thing, and then so but thankfully we were all non-infective. But we don't know, we did not get the symptoms. That was the thing. Things are different. Yes, yes.
This is indeed mind boggling to learn firsthand about your experiences. Due to the increased risk of exposure to the virus, our doctors, nurses, and healthcare workers fear that they may contract COVID 19 themselves. One can totally imagine the stress about bringing the virus home and passing it on to loved ones and family members, elderly parents, small children, and immune compromised relatives. Abhishek, how are you dealing with panic stricken patients, especially children, since that's your area of expertise? And how do you go about every day risking your own health?
So Lumbini, this one of the thing which we had to go means in my profession, that is the pediatric orthopedics. So we have to take into account the patient who is a pediatric child, his mother who will be obviously very anxious because of the orthopedic part as well as the COVID. So these are the two things which we have to take care. One is the COVID background, COVID fear, and the second thing is the orthopedic part. So that was simple formula which I told you that when we used to examine pediatric orthopedic patient in our OPDs, and we suspect that this might be case of a COVID positive patient, what we used to do is simple isolation. There were two OPDs which we used to run in our CMC. One was exclusively for all COVID patients or COVID suspected patients. And the second, which clinically we thought are not having the symptoms, can be COVID positive, but clinically they are not having the symptoms. So this is how we used to segregate. And definitely we used to defer all the elective cases, that is all the cases which can be deferred to around 3 or 4 months. We used to redate them, and emergency definitely we used to do it. So the main problem which we used to confer as a pediatric orthopedic surgeon there was, see, in CMC, I'll see, most of my experience is from the CMC Vellore, which is a tertiary referral center. So we used to get refer from very far from the country. It is in Tamil Nadu, but we used to get patients from Delhi. We used to get patients from Kolkata, from Bombay, from this Gujarat. So people used to come and they used to tell us that coming here has got coming to all the way traveling all the way to Vellore was itself a very tedious job for them. So when we are deferring them with 1 month or 2 months and redating them, they were telling that if we go, we will not be able to come back. So these were a tricky situation where we were forced rather to work against what was the usual norm. So these were the things where we had undertaken some elective cases. We had done, keeping in mind that if we do it, there is a very high chance that we might risk this child to a potential COVID infection, because keeping in hospital was itself a source of COVID. So this was how it was. So, but again, things are different in a tertiary care hospital where people come from very far. So this was one of the prime thing which we had, which we face the main problem, that when people are traveling from far off,
Mhm.
um, deferring them a surgery which is
Right.
required, we know,
Right.
just because there is COVID. Uh, Sometimes it's okay, but sometimes it was difficult. So that is one. Second, when what used to happen was even being an orthopedic surgeon, since COVID load was so much that we used to, as the institution wanted us to go and help all the medicine faculty. So that was also one of the jobs which we used to undertake apart from our routine surgeries. So in our free time, suppose in our non-operating days or non-OPD days, we were happy to help in COVID wards. So that was one more thing which entire entire faculty, okay, entire medical faculty, I would like to congrats them, because this faculty from other department also happily came and they extended their help to respiratory medicine department and the medicine department, who were in the forefront. So that is one thing which I congratulate the all medical faculty. It is not that the medicine people who are definitely in the forefront in ICU or in respiratory units where they're taking care of the COVIDs, but also the surgery part, the orthopedician, all from all the country, they came, they joined hand, and they all are fighting. So this is how all our things were.
Okay. It's amazing to see how, despite going through so much of turmoil, nothing deterred you all from doing your duties. Oriom, are many other life threatening diseases going untreated due to this panic associated with COVID, where probably many are misdiagnosed?
Yeah, hi Lumbini.
Hello.
So this is absolutely right because uh, COVID is has come and it is going to stay. But diseases that are already existing and they are prevailing for such years and years, they are definitely not going to go. So they will be there along with COVID. So now, what the thing is there that as the doctors are also afraid of treating the patients because, as Abhishek told, that everyone's life is important. So maybe when we are getting a case of fever, so it may be because of COVID, but it may be because of other diseases also. The other causes of fever are there. Till 2019, what was the most common of fever? We had to rule out tuberculosis. We were dealing with malaria. We were dealing with dengue. We were dealing with other infective diseases, and they are there. So not only any fever cases is going to be COVID. So what the thing is going on in all over the world, whenever the patient is having a fever or any respiratory tract illness, they are first of all they are not going to the doctor, because if they go, they will be asked for a COVID test, and if they are found to be positive, then they will be sent to some quarantine center or isolation, and they will be not allowed to work. And we know that in such a uh, means developing country like India, if the people don't go to work, definitely they will starve to death. So this is the reason that these patients are not going to the doctor to say their symptoms also. Initially, when uh, I used to see patients just 2 years back or 1 year back, I used to get a huge amount of fewer patients who are coming and readily telling me, "Sir, please do me, give me this investigation. I want to get diagnosed." But the thing is a totally different story now. So, what is the pitfalls of this scenario? If the patient is having a dengue, then he is better staying at home, and he is only coming to the hospital when the dengue has already deteriorated and killed him at the last stage. Maybe malaria, we have all the drugs available for treating malaria. If it is diagnosed within 1 to 2 days, we all have suffered from malaria, but we are not getting those treatment, and they are better staying at home thinking that it may be COVID. It may be because of social stigma, it may be because of the flat members, that yeah, this person in this flat number is having a fever since 2 days, and this he has been marked now. So because of that fear, if another person is getting a fever, he is thinking that I should not reveal my fever status to my neighbors, because if they know that I am having a fever, then something will go wrong with my family. My family will be not getting the basic necessities and amenities of life. Maybe rasan pani band ho jayega. So this is the thing that is going on. What the problem is there with the hospitals, maximum hospitals have either branded them as COVID hospitals and non-COVID hospitals. There are very few hospitals left which are all totally dealing with both the groups of patients. Now, any respiratory illness is going to cause only three symptoms only: shortness of breath, cough, and dyspnea. These are the only common symptoms with any lung disease will cause. And these are the symptoms with only COVID only. So maybe a patient with tuberculosis is not getting diagnosed for 1 month. Maybe a patient with lung malignancy, lung cancer, is not getting diagnosed till the is already in the last stage. And these patients are dying. And when they are going to the hospital, initially the X-ray or CT scan, they are all close mimickers with COVID. So patients as well as the doctors, they are telling, okay, first you go to the COVID ward, get yourself diagnosed, then only we will search for any other causes. So these things are causing delay in the diagnosis, and they are dying. And they are dying because they are not getting treatment. I have got n number of cases. I have got n number of cases since February. I have till now. I have got n number of cases that patients with tuberculosis, patients with lung malignancy, they're dying because they have not got the treatment at the right time. It's not the fault of the patients, because these patients have gone to the hospital, but because of this COVID harassment, they had sent back. They were forced to stay at home. I it was the maybe in the March or April, when it was the peak of the lockdown, when whole of world was just in the state of panic, in the name of COVID only, in the panic in the name of test only. Till now, I will say, maybe Abhishek will also agree with me, but till now we don't know that if a symptomatic patient is having a COVID positive result, we cannot rule out that he is not suffering from any other disease. Because as they are asymptomatic carrier, maybe I am seeing a patient with tuberculosis, and he may be an asymptomatic carrier of COVID. But once he is getting a COVID positive result, he's in the same point, he is being transferred to any COVID specialist hospital. And there he is getting only COVID treatment. Nobody is bothered to see what are the other diseases that may be there in the differential diagnosis list. So this is the fate that I I think that This has to be this will be changed. I hope this will be changed. It is gradually changing also, because we are accepting this, that COVID is going to stay with us. You see, HIV, it has come in 1970s. It is still with us. Now the term has come that people living with HIV and AIDS. So whether the COVID is an acute illness, maybe for some time, and then it will be having some comorbidities, or it will be present as chronic illnesses in some patients. We don't know that. It may not be just like Spanish flu, that it has came and it will go off in 2 year span. It may be that it may stay with us, manifesting as any other disease. Just a example from my side. I am a cardiologist, but from viral point of view, not a single virus comes to destroy a human being. The virus wants to stay within us. It takes food from us. So it is a symbiotic relationship. It wants to take from food from us, and it is going to stay in us, because if a virus causes harm to me, then definitely the virus is not going to survive, because if I die, the virus within me is also going to die, because virus needs a cell, will need a human living cell to survive, because if I die, the virus is going to die. But the thing is that it's a war between my immune system and the virus that is causing a collateral damage to the organs. For example, if India and Pakistan isn't a war, maybe the common people in the Kashmir are getting killed. So the Kashmir is me, my body. The war, India and Pakistan, the Pakistan being the virus and the India being my immune system, the soldiers, these both are fighting. And the common people, that's me, is dying. So I don't know what is the answer, what will be the solution to that. That maybe that some cases we are treating with immunosuppressant. Abhishek will agree with me. We are treating with steroids.
Mhm.
My patients who are diagnosed with HIV, their status is very good. They are not having any symptoms. Not a single patients who are uh, with SLE or rheumatoid arthritis, who are already on immunosuppressive treatment with maybe with methotrexate, maybe with ACQ, where they were taking for long duration, they are not having any symptoms. If also they are contracting symptoms, maybe they are not ending up with any life-threatening organ damage. Other things that are the problem is that when the patients with anything, maybe they are coming to the hospital, maybe a patient with heart attack comes to the hospital. So when the patient reaches, he's stamped as a COVID unknown person. His identity is, I don't know his COVID status. It's just like an Aadhaar card. Now it has become an Aadhaar card. Okay, he is positive and he is negative. But till he is positive or negative, he is COVID unidentified person, and he will be staying in a ward which is a mixture of population, where there may be a suspected, where there may be unsuspected, where there may be any patient who is totally admitted with some any other reasons. And then the segregation will take place after the COVID reports come. If the report is positive, they are going to a COVID ward. If the report is negative, they are going to stay in a green zone. Okay. So now the report is coming within 48 hours. Now it is 24 hours, but 2 months back only, the reports would take 48 hours to come. So in this 48 hours, maybe the person who is not having a COVID is getting a COVID infection from a person who is there in the next bed. So these are all the problems that we are facing now. And maybe our whole generation will give a message to the coming generation to how to deal with the pandemic, if again it's come, because it's always in a 100 years one pandemic will be there if human race is going to survive. So I think these are the problems that we are facing. Yes, we are at a high risk zone. Definitely the soldiers are also. We are going to do our duty at the best that we can, but at the same time, definitely we have to protect our family also, because each and every individual should be responsible of protecting him as well as family, and doctor is not uh, exceptions to that, because if my family get infected, they are definitely going to infect my neighbors also. So it's their all individual duties. So I think I have answered
Yeah.
whatever there is in my mind.
True. Since people are being asked to practice physical distancing and minimize outside activities in current lockdown, many people who would otherwise be using healthcare are now choosing to stay home. Now, some chronic patients need regular visits. For example, people of chemotherapy, etc. Would you like to share some tips to ease out their level of panic during the visits?
See, chronic patients, definitely these are cancer patients, the patients with heart failure, the patients who are living with chronic lung disease, maybe COPD, and other comorbidities also. The common things that are diabetes, that is hypertension, that dyslipidemia, the patients with thyroid diseases, the patients with neurological diseases, survivors of stroke patients, maybe the patients with residual hemiparesis. All these patients, they need regular treatment. Now, with the digitalization, definitely if the patients cannot come to the hospital, I always encourage my chronic patient to sit back at home, consult a doctor at the comfort of their home only. Because in that case, only the thing of uh, asking the patients to come after 3 months, you have seen as a uh, general non-medical person, you always see that a doctor always writes review after 3 months. And maybe if you are not having any symptoms also, you are taking your patients to a doctor after 3 months. And some people think that, yeah, that doctor is a money maker, so he is always asking a visit after 2 months. The thing is not that. The thing is that with a regular visits, I can assess the proper compliance of the medication of the patients. Is there any side effects that is going on? Is there any more drugs that we can add for the betterment of the patient, so that future of the patients is good? But now some guidelines are changing during this pandemic seasons. Unnecessarily visiting the hospital, definitely I am not encouraging that. My patients who are good, I am asking them to stay back at home, take their medication regularly, and yes, consulting me over phone or over video consultation, over digital platform at the interval that I have told them, maybe 3 months, 4 months, 6 months, so that I can assess the compatibility with the drugs and any side effects that is going on. And yes, the patients who are immunocompromised, maybe because of chemotherapy, maybe because of uh, neurological problems, they have to follow all the social norms as per government guidelines, social distancing, maybe masks, maybe sanitization, everything step by step, every day, every single moment. We cannot just ignore that a person next to me, my person that is the friend, my driver, he is well, so I can just open my mouth and talk to him. No, this is not the thing. The problems they have faced during this pandemic is, if they were having any problem also, they were not getting proper transport to being traveled to the hospital. Because of the lockdown, everyone cannot afford a ambulance or a private car to be driven to the hospital. As Nandi already told Abhishek, that every hospital, a tertiary care hospital, patients are coming from long distance. So definitely when the flights were not there, that local trains are not operating, definitely these patients cannot afford to take a private car and come to the hospital. They were not getting drivers. I just share an example. My wife, who is a doctor, and he is going to a Bangalore hospital, that is a COVID hospital. I am not getting a driver. Sometimes even the Uber and Ola people, they are confirming the location and they are canceling the trip because someone is going to the hospital. One incidence is that my car, my driver, and the driver strongly protested that he is not going to park the car within the hospital. So when some doctor sees all these things, definitely he gets an edge that for whom we are serving. It's these people only that we are serving, we are risking our life. So if a doctor who is in the forefront and in the leader is facing such problem to reach a hospital where he is working maybe for last 1 decade, and definitely patients who have been diagnosed with a disease maybe for last 1 year or 3 months, definitely think about the problem that he will be facing to reach a hospital. So things are like that only. So thanks God to the digital media so that we can consult over in Zoom apps, we can consult over WhatsApp video chatting, so that for the time being we can just adhere with the compliance with the patients. But definitely with the patients need some intervention, patient needs some routine checkup where I have to place a stetho to the patient. He has to come, and in hospital definitely all the precautionary measures they have to go through, like thermal checking, proper sanitization. Even after all this thing only, they will be letting to the OPDs with proper precautions. And definitely, if patients need some active intervention, nothing is going to stop from a patients getting a treatment. That is, I think, our India has showed this effort. All the doctors, right from uh, primary health centers to Apex Hospital, they all have come forward so that not a single person get denied of treatment, denied of a necessary surgery during this pandemic. Even the patients with COVID also, because a patient with COVID positive may get a heart attack. So I cannot deny him. A patient with COVID positive may get an complete heart block. So I cannot deny him that, okay, your heart rate is 20, you wait for 2 days for your COVID report to come, then I will give you a permanent pacemaker or temporary pacemaker. So any life supporting thing I have to do. Just think about a patient who is having a cardiac arrest in the emergency department, and a uh, consultant, emergency consultant, or a cardiologist defibrillating the patient, or an anesthesiologist intubating the patient just standing in front of his face. And just one small irritant going into a pharynx and you cough, and that anesthetist or a emergency phys consultant is giving a tube to a subconscious patient who is just gasping of breath without even thinking of how many droplets of spit is coming to his face. And this is the reason that the mortality among the anesthesiologists is much more. They are dying, and they have died since after, before initially they were not using the face masks, but then after using the face mask also, there are a proportion of patients, doctors, they are losing their life. So the compliance with medications is important so that comorbidities can be reduced, so that even they develop a COVID infection, if the comorbidities are treated well, they will live properly with COVID only, they will recover well.
Despite serving patients such sincerely as you just described and risking their lives, healthcare employees are often being treated very badly. Abhishek, tell me, considering the present scenario, how extra vigilant or cautious you generally are, because many patients are showing up without any symptoms, as Auriom said. Do you have any critical experiences to share?
Lumbini, hello, Lumbini. So this question is, I don't know how to answer. See, when we are seeing child, suppose in an emergency, I see a child with a fracture. So the classical saying now everyone is using this term called SMS, that is standing for sanitization, mask, and social distancing. So these are the three things which everyone is saying. If we do all the at least these three things, we will have some protection against COVID. But when I'm getting a child, maybe a 5-year-old or a 6-year-old child of a polytrauma getting some accident in emergency, how can I maintain all these three things? At least what I do is I just wear a mask, maybe a face shield. I have to go near her. Many times it happens, how many times I can wash my hand or come sanitization, because when we are examining a polytrauma patient, There is a fixed time limit. In 5 seconds, I have to see the airway, breathing, circulation. So it is not possible for us before putting hand in the body of a patient always to use sanitization or wash. All those things are not possible. So the SMS theory, at least I personally, while seeing my patients, at least in emergency, very seldom I have followed. I'll say I have not followed. Okay. Yes, in OPD, yeah, it is a different situation where I can stay at a distance of around 6 feet. But yes, as Auriom says, there are a lot of places where we need to get up, go, touch the patient, and then come back. So there we cannot tell that since it is a COVID situation, I cannot go and examine a condition which requires a palpation or auscultation. These things we have to do. So critical situation, personally, I don't have any. Only one experience I just wanted to share. We were in emergency and we were in emergency duty. So we got a child with this 2-year-old child. Somehow he, while playing, the child fell down and there was a elbow fracture. And this is the fracture known as a supracondylar humerus fracture. Okay, most common fracture in a child. But only bad thing about with this fracture is the artery which supplies to the hand, it usually get injured during this fracture. So this child, we were not getting the pulses. So in the middle of the night, we took a decision that we cannot wait for the COVID results. As Auriom was saying, it used to, those days, it used to take at least 48 hours. So if I would have waited for 48 hours, maybe after 48 hours, the hand would have gone into ischemia. And after 48 hours, we were left with only amputation of the hand. So you can imagine a 3-year-old getting her right hand amputated. So it is there is nothing left with the child. Okay, so we went ahead with the surgery. uh, Thankfully we had a COVID team with us. So we went ahead with the surgery. We did the surgery. We were able to get back the pulse and the hand was saved, and later that child came out to be a positive. But still we did not follow any rules which which everyone had set, but we were able to save the child's hand. So we were happy. Okay. Uh, we were happy as well as I was worried also while returning from that surgery. I was always thinking that now whether I should go inside my house or I should rent a hotel and stay there, or I should stay in a hostel, segregate myself. I don't know. So thankfully we where I used to stay, there were veranda where there was a separate room. So I told my landlord that I just wanted to use this room for 10 to 15 days. Initially he was a little hesitant, but then I convinced him, and I was staying for around 10 to 12 days in isolation in that room. So this is how we were able to do. So this is only one situation one example which I gave, but there were around 5 or 6 this kind of situations which we had taken a decision of doing what was not told in order to protect something which is more important. So this is how day-to-day life is. Even if we say that these are the things we need to follow, means how to follow we don't know, because situation demands us to work like in a proactive manner rather than a reactive manner. So this is one of the situation, and I'm sure Auriom will have numerous examples of these because he's dealing with this cardiac sciences. So he will have, I think, n number of examples of where you have to work without a COVID result in order to save a child, save a person's life.
It's absolutely extraordinary to know your stories firsthand. Orium, you were earlier once mentioning your thoughts about the stigma that this pandemic has created among the masses. Is it justified? And how do we balance public health responses along with stigma mitigation?
See, stigma is with everything. In fact, not a single person wants to reveal their own disease to their family members, in fact, to other people. But most uh, funny situation I just faced, in fact, 1 week back only. A person came with a COVID report, and his son just wanted me to empty my chamber. All the sisters, all the caretakers were just driven out of the room, and he came close to me and whispered in my ears that my father is COVID positive. I told, see, by doing that, first of all, you didn't maintain a social distance. You came in front of my ears and whispered it. And secondly, definitely your father has not come out to be a HIV positive. Your father is COVID positive. So this is nothing to be feared about or a thing to uh, give so much stigma upon. You are just worrying. I don't know what we is giving us so much worry. Nobody is going to tell that your father is characterless, that you are gotten COVID-19. Getting a COVID-19 is not your fault. It's an communicable disease that is an airborne, and you can getting it from an environment where you are staying. So it's not your fault. Patients who are becoming COVID positive now, they are thinking that they are responsible for that, and the whole society is making them feel guilty about that you are COVID positive and you are the culprit who is going to make our whole society contaminated with that virus. But these people are not knowing that they are in fact staying in a world where whole environment is having a good viral load, and anyone can get it. Everyone can get it. Some are asymptomatic, some are symptomatic, some are very much symptomatic, and some 1% or maybe 1 to 2% are dying because of other comorbidities or some unfortunate reasons. The problem with this stigma, why this stigma has come? The stigma has come because when the lockdowns were imposed, the people were sent to some quarantine centers. The home that where these people were staying, suppose a one person from the whole society becomes positive, that whole society was just gherao. It was just gherao by policemen. They were harassed by local authorities. Therefrom the stigma has come. If I am being denied of my day-to-day livelihood, maybe I am asymptomatic and I am denied of my day-to-day livelihood, just you can imagine that uh, a patient who is a COVID positive, 3 months back, he was just labeled that he is a rapist. The thing was like that. You think a father and mother of a rapist, the abusive language that the people will use about them, the same thing was extrapolated to a patient who were COVID positive. It's your son that is bringing the virus to our society. Why you have let your son to go out? Some odd person will pop up and tell, I have seen that guy who was there in the shopping market, shopping mall. I have seen his father taking buying a fish. Are they will buy, they will go out. If they are not going out, how will we eat? If I am not go out to work, then who will pay for my EMI? Who will pay for my home loans? Who will pay for my fuel? Who will pay for my kitchen? So all these things have attributed to the stigma. Now, what have become and other things that have a asymptomatic person has been home segregated or maybe in quarantine facilities where there was not a proper infrastructure. I need some food to eat, a proper food, maybe a COVID positive when I'm maybe any viral illness, I should be fed properly. High protein diet, but in the quarantine center, it's not anyone's fault. But as we were not prepared to handle such a huge pandemic, so definitely the infrastructure was not so good. There were not proper bathrooms, there were not proper toilet, the hygiene was not maintained, the food was not there, the water was not there. We have seen all this in news, and I have seen that proper in my eyes. Just think about a situation that a lady has come to be a COVID positive, and she has a 2 years old child, and all have been separated. All have been separated. Okay, so not all persons are from Ambani and Birla background that I will be having 4 to 5 houses. So if I am being separated from my family members, and maybe I'm asymptomatic, my wife is also asymptomatic, but my wife is having a fever and she is forced to stay with a 2 years or 1 year old daughter in some facility where there is no facility. And I am in another center, and I am thinking that what will happen to my family where they are. I have no contact with them. Now the rule has come that any person, any hospital, the video conferencing can be done with the patient relatives. I don't know where they are going. Numerous reports are there in the TV channels that when a patient has died, they don't know where the body is. The body has gone missing. The way the body has been burnt up, the way the body has been disposed, the way there was lack of communication between the health authorities and the patient relatives, definitely the stigma is going to be there. Another thing, if I ask you to stay in your room only for maybe 15 odd days when you are not having any symptoms, definitely you will suffer from some sort of depressive symptoms. If you are not having any psychological disease, you may develop it. And if you are already suffering from an anxiety disorder that I also do, maybe that will get aggravated. There are numerous factors. First is loneliness. You're lonely in a room, maybe with a Netflix. How much movie will be there? अरे लॉकडाउन में तो उतना movie भी release नहीं होगी. Actors were also there in isolation. Maybe in 2 to 3 days you will finish up watching all the web series and all the thing. Next thing, you will worry about your job. Not all people are working in government job that their jobs are secured. The people are working in private firm where the physical appearance, if there is not there, they are at risk of losing the job. Just think of maids, just think of drivers, just think of our malis, just think of some fruit seller, vegetable seller. If they don't come to the work, how will they earn? Definitely they will be replaced by some other food vendors. So they will, naturally they will go into depression. And by seeing that, okay, that a person was COVID positive, he was forced to stay, and he has lost his job now. After coming out of 15 days also, now he is also not going back to job. So if I am getting fever, I am not going to disclose it. I am not going to disclose my fever status to anyone. Okay. So what is happening? We all have gone to school also with 99 temperature. Yes or no? Everyone. Maybe if I was having a fever, sore throat, or a running nose, my school teacher has told me, no, these are mild symptoms. You have to do your homework and you have to come. It means a person with fever can do his regular activities. So definitely, if I am having a fever also, what is the need? I just have to go for a thermal check that I have to pass, na? I will take a paracetamol 650 or 1 gram just 20 minutes prior to getting into my office. I have my temperature checked. Yes, it's normal. I will go into my office and I will start spreading the disease like anything to all my colleagues. So this was the thing, that the social stigma, when it is built up, has caused the boom in spread of the virus. The explosion of virus was like this only. And another explosion was overburden of psychological diseases. Now just think, exploding virus, exploding news in the news channel, and explosion of the depressive symptoms. Just thinking that such and such person has died, such a renowned personality has died, so many actors are dying. If the actors can die, who am I? If the person with so much crores rupees in bank, who can spend anything and anything in this for saving his life, is dying, me who is none, I will die. This is happening. So what we have to do to change this scenario, equally with isolation as it is important, the cooperation is also important. The cooperation from neighbor, the cooperation from administration, it is important. Okay, you're COVID positive, but we are there for you. So I have changed this in my society. Initially, what Abhishek was telling, definitely this was there in the WhatsApp group. Such and such mother is suffering from, uncle is suffering from COVID positive. Don't let that person enter. Direct security person was messaged by society people and he was stopped. But now the things have changed. Now in the WhatsApp it is being written, his father is suffering from COVID positive. So let him inside the house. It will be society people us who will be responsible for giving him all the food, all the water, all the medicines, everything that is required at his doorstep. With proper with proper precautions that has to be taken as per government guideline. But this is the hand that we have to extend to the COVID positive. Then only we can stop it from transmission. Then only we can stop it from spreading to other people. So uh, this, I think, has helped. This, I think, will become a norm as we have to survive. Because see, it's a 130 crore population. So to bring the calculation easy, suppose it's a 100 crore population, and to get an herd immunity, I know 70% of the people should be infected. Okay. So if in a 100 crore population, 70 crores have to be infected to have a herd immunity, maybe by local transmission of virus or maybe by vaccination. 70 crores have to be infected. Okay. 70 crore population means how many family? Myself have around 100 loved ones around me. Maybe my auntie, my uncle, my nephews. Okay, my blood relative. If they die, I will be affected. I will be depressed. Huh? So maybe 100 people are there whom I care about. If they die, I will be affected. So that means 70 lakhs. There are 70 lakhs families. And if 70 lakhs family, if the mortality is 1 to 2%, it means 7 lakhs is going to die. It means when we will be attaining a herd immunity by either by vaccination or either by local transmission of virus, I will lose two of my family members. If I am having 100 people of family with me, I will be losing two of my family members. Just think about it. It's a thing to uh, worry about. Because if I am going to survive for another 50 years, then I will have to take a burden of that I have lost these two people in my life because of this pandemic. Just think about this. So I think each and every individual should come forward and educate our friends. Each and every people we meet, we should educate them either by digital platform or by personal communication, that it's not your fault that you are getting COVID. It's environment fault. And don't disclose, don't ever keep your symptoms within yourself. Discuss your symptoms, and once you get the symptoms, stay in the isolation. Each and every company should back up their employees. Till it is not being done, COVID is not going to stop. No vaccination is also not going to help it. In within 2 years, definitely it is almost next to impossible to vaccinate 130 crore people. It is not. It is not at all possible. It's myth. If the vaccine is there also, maybe it's costly also, then also if I have affordability to buy it also, then also I cannot vaccinate 130 crore people in 2 years time. I think Abhishek will agree with me. It's impossible. Impossible. So only thing is that educate, 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 isolate, 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 cooperate, cooperate, cooperate. Just three things, nothing else.
True, we need more than information to reduce COVID-19 stigma. Abhishek, it seems like long are situations during the pandemic. Moreover, your visiting card tells me you have been continuously on your toes as you are extending your services to various different areas that are quite at distance. Has this created a personal turmoil in the household too? How are you all maintaining the composure during this stressful time?
Well, Lumbini, this question, actually, I don't want to answer, but
Okay.
I know since we are in a public forum, I have to. See, in last 1 month, as Auriom had given a data that we will all lose at least two of our close relatives. I have already done it. Okay. So one was a direct death and one was an indirect death. So my cousin, so Amar Pishi Chile, so one of my brother, he was 27-year-old. Last month I lost him. So now the reason was, see, everyone is blaming COVID, okay, but I blame the ignorance. Okay, when the symptoms were mild, they were all fearing COVID. That if I go to a hospital, they will treat me as COVID, and even if I am not having a COVID, they will stamp me as COVID and they will keep me in isolation. Then if I go there, what will happen to my old mother? What will have happen to my 1-year-old child? And what will happen to my wife? So this happened. So finally, the day he succumbed, uh, I was traveling from Midnapur to Jamshedpur. Okay, so I was in my car. So suddenly, sorry, this is the day before. His wife told me that Dada, this he is having this high grade fever. He's not speaking, and he's not feeding. He has lost around 10 to 15 kilos in last 2 or 3 weeks. So what should we do? I told her, see, the symptoms are of COVID. You immediately go to a hospital and get admitted. Okay. Then my sister-in-law, what she told that this if I go to hospital, everyone will have this stigma of COVID. With this stigma of COVID, everyone will isolate us. But I told that if you don't take the decision now, anything can happen. Just only thing I was having in my mind that he was since 27 years old. I think I overdiagnosed it. Okay, and I told that okay, fine. Even if the symptoms are not very good, if you take him to hospital, even a nearest PHC, he will come out of it. I think that was my mistake because I should have told her to take my brother to some tertiary level hospital. So what was done was she called the local helpline and they went to a local PHC where COVID rapid antigen test was done. And surprisingly, my brother in rapid antigen test was found negative, but my sister-in-law was found positive, and the small child was was not tested that day. So they had brought my brother back home. Then again after 2 hours they called me and told that this is the situation. What should I do? I told, see, the symptoms of my brother is not looking fine. Okay. So even if the rapid antigen test has come negative, it can be COVID because PCR was not done. So you please take him to nearest hospital. But I think they did not, and they were taking over the counters some medications, some antibiotics and all. In the night, what happened was the fever came down. So this is the usual course of this corona infection. I think Auriom will be more informative regarding this. This the fever will come first, then the fever will come down. After some days, the respiratory symptoms will start. The shortness of breath will start. So here my brother did not have fever, So everyone were very happy. Okay. So they were a little complacent. Next day morning, okay, I was traveling to Jamshedpur, and suddenly in the car, my this sister-in-law, he called and he told that, see, he's not speaking, and some foam kind of thing is coming out of mouth. When I saw, it was all secretions full in the mouth, and I immediately told, see, first you make him sit, later you'll do everything else. So when they had made him take this 45-degree position, also 45-degree inclination position, his symptoms decreased a little, and they took him again to the local hospital, where they had told that this situation is going from bad to worse. You please go to some tertiary care hospital. So in the way, while traveling, my brother succumbed. So I was very furious. Okay. I was very upset. I was very furious. Very furious in the sense, means, because I was not able to do anything. Third was, I was furious with the hospital because they were not having a proper suction also, just to clear the throat of the secretions so that he could travel at least 1 hour to a tertiary hospital. So that was the situation. So this was the one. So I was recovering with this situation. Okay, so it is 1 month now. Suddenly, this last week, uh, my uncle-in-law, Mama, okay, now he was a cardiac patient, definitely yes. So he had his ways of life. He was smoker, alcohol. He was uh, not very, what I'll say. He was having all these bad habits, and he was around 57. And this is the peak time of his business. This pre peri puja time. So now what happened was, every year before this puja, he used to get a health checkup done in Chennai Apollo. But this year, because of this COVID situation, he was hesitant. Okay. So all his medications, which he used to take regularly, because as Auriom told, getting a regular checkup, um, people used to say, people might think that it is the doctor who wants money. That's why he is calling after every 2 months or 3 months. It is absolutely not. I can guarantee you that getting a regular checkup from your treating doctor is paramount important of for any chronic illness to get treated. So what he did is, he his yearly visit, my mama, he did not go because of this COVID situation. So all the necessary drugs like blood thinners, he had stopped for at least 2 to 3 weeks. So he was not on aspirin, he was not on clopidogrel. These are all life-saving drugs for all any cardiac patients. They will have this danger of getting thrombosis in brain or in heart, all these things. So he was not on, and because of the stress of this business, he used to smoke a lot. So what happened was, last these 3 or 4 days, these all these activities aggravated, it accumulated, and suddenly 10 days before, in the morning, I'm getting a call from my mother at 7 o'clock that my mama suddenly collapsed at 4 o'clock in the night. We were all shocked because yesterday only I went to pay a visit of that Shraddh, and today I came back. So that's what happened. I was a little busy last week. So these two loss in my family are means we did not expect. So it happened suddenly. It happened abruptly. I don't know whom to blame. Okay, it is the stigma of the COVID, or it is the virus, or it is our ignorance. Okay, so I don't know. So these are the two personal experience which you wanted me to share, but these are quite bad actually.
It was
I'm
quite
sorry.
brave of you, rather, to have come out like this and discuss. Mm. It's really mind-boggling to know such experiences happen to doctors as well. And I'm sure that, many patients do not know what you all go through, the kind of ethical injury, the kind of moral injuries while taking major decisions on the operating tables that you probably often have to.
I just wanted to say one more thing. When this entire story came, I'll this neighbor thing. Okay, a good neighborhood and a society means a lot. We all are social animals. Okay, so we cannot stay alone. So think what happened was when my brother succumbed, the neighbor did not cooperate. So as a result of it, he had to, my sister-in-law and my aunt, they had to close their house and they had to go somewhere else. Now they are with my cousin sisters. So a cooperation from neighbor becomes becomes paramount and becomes very important when you lose someone so close. So as Auriom, you were shouting, okay, fine, the education, and what are the three things you told? Sorry, can you repeat once more, please? Auriom, can you?
Isolation, education, and cooperation.
Correct. So isolation, education, and cooperation. Okay.
These are
So
the
I think,
vaccines.
yeah. So I think we should now the situation has come that we should inculcate these three words in our mind: isolation, education, and cooperation. Cooperation should be in hashtag because things are very difficult. It is very difficult
Pers-
to
Person
stay
who has not
calm.
cooperating, now the things should change. The person who has not cooperating should be sent to the quarantine center.
Maybe yes. Okay, it
I
should be
think
like that.
sometimes I am just furious about these people. One day a person from my society only didn't allow me to park my car, and I have to call up the local thana for that. So I think these persons should be put into quarantine center. Then only they can change the sick mentality. And definitely, I have just
Happens.
mark that person. The once he will be having some diseases, I will see him. Then I will not have his car parked in the hospital. I will see to it.
Yeah. It happens. It happens. We all are worried about our
Mm,
near and dears, but we should not forget that this humanity
mm,
should be there with all of us.
mm.
Yes, I am
What?
worried about my father. I'll tell you my example. Yes, I am worried about my father. My father is very old. I am worried about my mother. But that day, when I gave you the example of that child coming with a pulseless hand,
Right.
if I had thought about my father and my mother, and I would have taken a reactive step, thinking that my mother and my father are there, I might contract a COVID and I might transmit this COVID to my old father and my mother, who are definitely above 60 years,
Right.
and chance of them getting COVID and
Mm.
ultimately succumbing to it will be high. If I would have thought this before taking this decision of operating on that child might have lost her hand. So this should be there. We all are worried about our dear ones, yes, but there are certain decisions which we need to take as humans also. So this is what I'll say. I totally agree. IEC, that is the three words as Auriom told. That should be, I think, the last message from this talk.
No, there is another message for the
Okay, fine.
doctors.
Okay,
Recently, one of my friend only told me
okay,
1 week back, 1 to 2 weeks back.
okay,
Don't wear a badge of overworking doctor. Don't
okay,
wear a badge of overworking doctor. Just
okay,
like we were telling na, that we pretend or we really are very busy, sleepless nights, okay, jobs not done, OT not done in the proper. We have to stop think about it.
Right.
We have
Right.
to take care of our health only. That friend was Lumbini herself. She told me, and within 2 weeks, I have definitely stopped. See, I am smiling. I am very good now. Within 2 weeks, I have taken around 4 days of rest, and in these 4 days, my official number is totally in switched off mode. So no one to call me or anything, because I have to take care of my own health. Then only I can save that person. You have to take care
Correct.
of own health. Then only you can save your pulseless hand of that child.
No,
If
I
Correct.
you
think the
die,
first thing that, the glorification of doctors as they are not gods. I mean, we have to stop telling them that you are gods. You all are humans. You all have had proper education and you all are trying to save people's lives. And, as Abhishek has shared and as you have shared, you have a child at home, Auriom. I do not know how you're doing it on a everyday basis. I fear going to the local market and coming back because I have a toddler at home. He has a aged parent at home. I do not know how you're doing it on a daily basis, seriously. And now that you all are telling your stories about, you know without doing things without protective gears, etc., it's really shocking. And I think that, this
the
perspective.
the protective gears, the PPE, it's really not possible to wear a PPE and
And
operate for
operate.
around 6 hours. It is not possible. Okay. And just the comedy scenario in the OT is myself is not getting fit into any PP. So a PP, if I wear a PP for 1 hour, maybe I will die of cardiac arrest only. Okay. And there are people, I am fat, there are more cardiologists who are more fat, and in fact the PP get torn off them. So it's not possible to wear a PP and operate. And
And
problem with me, these glasses. Okay,
true, true.
any doctor,
Visibility.
and I think 99.9% of doctors are having glasses. If Abhishek is not wearing glasses, definitely in chamber he is wearing a glasses. Okay, so so whenever in intervention cardiology, actually I work on some millimeter things and I
Mm,
see it in magnified view.
mm.
So whenever I breathe out, everything goes off like in the white snow, and I can't see anything. So I stopped wearing PPE also. I have stopped wearing head shield. Everything I have stopped. Just N95 marks, and I give two N95 marks to my patient only. You add that so that your droplets don't come to me. And these are the way that we have to live. Sometimes everything is bit comic also, but its life is going on like that. Till I am healthy, I am smiling, but the day I am down with fever, maybe some erroneous thoughts definitely crawl in. What will happen to you? We are also human beings. So just
Right,
on the lighter
exactly.
note, yeah. So
Any
Lumbini,
other?
any other question?
No, any other closing comments if you both have, though you have totally given us the proper solution to, not wait for vaccine and follow whatever is possible right now. Do you want to say something about the stretched infrastructure or anything else, or anything about uh, to the patients or anything else? Then, we can have that as your closing comment, and then we can draw a
See,
closure.
infrastructure is what, na, Lumbini, we cannot just make an infrastructure within seconds. Within 6 months, we cannot make an infrastructure. Within 6 months, that we can do is a IWAS. Okay. And IWAS is not going to save a patient. And from this example only you have seen, na, if there is no suction machine in a hospital, then what sort of
Right.
infrastructure that I am talking about? So it is not possible. I may make quarantine center, I may make COVID hospital, I may make anything, but it's not possible within 2 years to create a multi-story building in a developing country where people are not getting food regularly.
True.
Where the people were dying before COVID, people were dying because of common diseases. We cannot save childs from malaria, we cannot save people from dengue. How can I think that within this 1 year I can make so much infrastructure uh, so that I can treat all my COVID patients? So it's not possible. It's not possible from practical point of view. It is not possible. Here only comes na, precaution is better than cure. It is the only thing. Cure, it is uncertain. We don't know the medicines, we don't know about the vaccines, we don't know about the natural history of disease. Maybe fever there, fever comes down,
Right.
then organ damage, but it is person to the varies in the person to person. The COVID is a multi-system disorder now.
Some person are dying of heart failure. Some person are dying of pulmonary ARDS. Some person are dying of acute AMI. Some person are dying of stroke. In fact, some persons are having encephalitis. So it's a multi-system disease. So there is no solution to that. Not a single treating specialist don't know that what is the outcome of that patients. We recently lost Soumitra Chatterjee also.
True.
He was in the high end sector. If I see that what is the optimum care that can be given to the patient, he has got that.
Right. Right.
What is the optimum attention care that can be given to a patient, he has got that. So it's different for each and every people. 3 months back we knew that okay, person above 60, person with comorbidities are at the high risk.
Yeah. Yeah.
Now 27 years is also dying, 30 years is also dying. So it's 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 a clinical spectrum that has no rules. The COVID is just like a badmas bacha who doesn't follow any rules. He's like a gangster of Mirzapur. He's just like a Munna Bhai. He doesn't know anything. He can only just suit anyone he likes. He can only dance in his own tunes, and we are forced to dance in our own tune. So that's the end of the story about COVID. The COVID is going to stay. We have to also go to stay. So we have to have a new normal that is already being inculcated within us. We should not politicize each and every aspect of COVID. If Durga Puja cannot be done, it cannot be done. We have to see next Durga Puja, so we have to stay at home for this Durga Puja. If you want to see next Chhat Puja, we have to stay at the home in this Chhat Puja. If you want to see our next Christmas, we should celebrate our Christmas at home this year. Minimize your unnecessary going out, partying in bars or clubs, going out in protest and rallies.
Mhm.
The things that we can cut down, the things that is within our hand. Unnecessary going out and partying for 31st of December is not necessary for this year. If these things can be spread as awareness to the common people, I think we can see 2021 in a better way.
Abhishek, do you have
This
any
is the
closing?
only thing.
Do you have any closing comment?
Well, Auriom has spoken everything. Actually, he has spoken his heart out, right? I was just seeing his emotions when he was speaking. So after those two experiences, I'll just tell everyone to be safe. Please be inside your house, inside the comfort of your loved ones and homes. So that SMS theory, that is the sanitization, mask, and the social distancing. So these SMS will be there. Please follow these because as we all are from Jamshedpur, so last week in Diwali my wife went to Jamshedpur and they were telling that I could not feel any corona there. Okay. So, I told, but I was in Kolkata. There was no cracker and all. But she told that, but it was everything was like a near normal. Okay, it was as we know, as I celebrated last year, everything was the same this year also. So there was that laddi of mirchi fataka. There was the rockets and all. So different people actually see these kind of things in a different way. So the people don't realize that things which they are doing are in some way affecting them and in greater way affecting the people who are in ends of their life like newborn and the old people. So transmission, I might be in my 30s, I might be a asymptomatic carrier, but the disease when I spread to my father or to my small brother or my nephew or anyone, they will contract that disease and they will show symptoms. So these things people should understand, and they should educate themselves, and all in each and every family members should sit together. They should plan their vacations, and I'll request everyone to be safe and inside the comfort of their houses. So, and also the new normals which we are following, like we are having designer masks and all, they look pretty, so please wear them. Okay. So that is how I will end it here. Please follow the new normals. Please be safe, and please help us to help you better.
So, viewers, as you all must have witnessed, that for all the reasons cited by our panelists today, it seems clear to us that working in healthcare during the COVID-19 pandemic will be associated with both short and long lasting social, economic, and psychological effects for healthcare employees. Despite all the complications and toil that the healthcare workers are facing, they are still managing to put forth their best efforts in serving the community. Thank you, Doctors Abhishek Nandi and Auriom Kar, for your insights. We'll continue the discussion in another brief segment with Dr. Megha Khanna, followed by this. Hello, dear Arterers. This section with Dr. Megha Khanna, who is an attending consultant obstetrics and gynecologist at Akash Healthcare Superspeciality Hospital in New Delhi, is a continuation of the dialogue that we opened earlier with Dr. Auriom Kar and Dr. Abhishek Nandi. Megha is a brilliant combination of dedication, intellect, and moral interest towards her immediate society. Let's extend her a hearty welcome. Megha, too, has been a COVID 19 warrior since the outbreak. Megha, COVID 19 duty was perceived as something fearful. We have to begin with the PPE suit issue with you. PPEs are a vital protective gear, but it's not easy to function in these. Do you think women would have added problems while operating in them, though they seem to be a site of discomfort for anyone who need to work long hours in an environment where the risk of infection is ever present?
Okay. Hi, good evening, everybody. And, that's right that PPE suits are a site of, a great discomfort. But I think to everybody, it does not discriminate male or female till if you consider the number of working hours in that heavy, poreless suit kind of it. It has very many pores so that the virus does not escape. That leads to excessive perspiration and uneasiness, and we are totally packed in it. It's not about wearing one mask or one cap, or it's just a suit. We have to operate for hours. Till few hours you can tolerate, but some operations that we are doing, or like I being a gynecologist, I have to monitor labor, and
Right.
that extend for hours. It can extend for 12 hours, 14 hours, and you cannot open and wear it again and again, because then doing and doffing are two different steps you have to do. So 3 to 4 hours you can do it comfortably, but when operations and labors are extending beyond that,
Mhm.
it's very, very difficult for anybody. Yes, in females there is an added problem, if I would say. When girls are going through the rough period of that month, when they are menstruating or having their periods, it is like very, very difficult. I had gone through a very bad phase during my duty hours also, because we had to be in suits for almost 8 to 10 hours a day for the first half. Then we used to doff it and drink water, go to the washroom, and then again wear it for the next extension. So yes, on those days, if you consider the difference, it is for women, otherwise it is for both. I must say, beyond 4 hours, it's really difficult. You cannot concentrate on your work when you are totally drenched and gone, basically. So yes, it is.
It sounds like the routine of getting into a suit and getting out of one is a complicated, meticulous process, and extreme care is needed to avoid any exposure. It must have also taken a toll on your body, as even the meals and water intake is scheduled due to them. Letting down your guard can expose your families to all kinds of risks. Tell us how you handle that front. How do you manage the daily emotional and mental pressures that many female health employees like you are under?
I mean, this is really unexplainable, the tremendous pressure that we are going through. Every day that I get out of the work, I have a 3-year-old kid. I leave him and I get back to work. Me and my husband both are into COVID hospitals. And when we come back, we just leave ourselves prepared, that we have to face it, we have to be extra cautious. And while coming back also, we make sure that when we enter our homes, our kid is not around. We lock him up in another room so that he doesn't see his mother who is back from work. And we directly, without touching anything our house, we just move in for our showers. We throw off the scrubs that we are wearing, the clothes that we are wearing, and not touching anything, not touching any family member, not our kids. So the emotional and mental stress is immense. But yes, somehow over the time we have prepared ourselves for it. As time passes on, and this is not going to end soon, every day you give strength to yourself. You get up and you think that yes, I have to take as much precautions as I can. Rest, something you have to leave on God also. So it's like that. So you have to just be extra cautious, wear your double mask. We wear double masks and
Okay.
keep sanitizing our hands, and then we are well prepared for the occasion.
Yes. It's humbling to think that there are literally millions of stories like these around the world right now. I feel incredibly grateful to every single doctor and nurse working around the clock, pushing themselves to the limit and putting their lives on the line, often with limited resources. Tell us about the stretched infrastructure that almost all hospitals are working on. What is the scenario and what could have been done to make it better?
The hospitals, I being in Delhi, so you must have heard about the present scenario of Delhi. It's pathetic, and I am in a COVID hospital itself. So it's in Dwarka. We are being overburdened with work. The infrastructure has been stretched, like they have added on beds everywhere. The doctors have sacrificed, we have sacrificed our working arenas, our duty rooms, everything for the patients. We have given it for the beds. And even in the different wards, the capacity of the rooms have been increased, beds have been increased. And I must tell you an incident you will be surprised to hear. In my hospital, we are even put in big triage tents outside the hospital, because you don't have any place in the emergency for the patients to stand. So the hospitals are trying their level best. They're incorporating more and more staff. They are rotating the staff more towards the emergencies, the labor wards, and where more manpower is needed. Triage is something. It's an area near the emergency where, when the patient arrives, because you screen it out for the primary symptoms, and if you think that any of the symptoms are matching COVID, then you put that patient in a triage, do the specific test, and so that that patient does not intermingles with the other kind of emergency, because routine emergencies are also there. It's
Right,
not that you're having only COVID. So the
right.
hospitals are overstretched doing all that. They have put in different tents, different areas of COVID and non-COVID segregation. What I've seen in my hospital is they're really working hard to segregate COVID and non-COVID floors, COVID
Okay,
and non-COVID lifts.
okay,
Everything is being segregated. They are trying, they have built in that artificial separators that
okay.
can separate areas, even if there are 3 lifts and one is for COVID and 2 are for non-COVIDs. In my hospital, they have put in a separator so that there is no interaction between the two. They are putting in infrastructural sources in different lift lobbies areas, so that whatever area that can be utilized is being utilized with no space resource left. So it's being a tedious part in the on management also.
Management also. Megha, women of reproductive age are most vital in the support of a family and the society as well. Losing
Mhm.
their health and well being owing to COVID will be futuristically tragic. Would you have any tips for women who probably are in some stage of the childbirth process, even if it means from conception till postpartum?
Yeah, this is a very vulnerable group, I must say, and needs to be extra cautious.
Mhm.
As pregnant ladies who are in their antenatal period, their immunity is already compromised. They are already immunocompromised owing to the different changes in their body, the hormonal milieu they are going through. So they need to be extra cautious. I must say, women who are not working, who are at home, must be overcautious with the articles that are brought out from outside. The funda is very simple. You have to be focused on cleanliness, washing hands, and taking precautions. Women who are going out to work also need to be extra cautious, wear masks, using sanitizers, and avoiding unnecessary interactions. Gathering for antenatal mothers is a must nowadays. What we have started in our hospital is teleconsult for these antenatal mothers who are in early part of their pregnancies, who do not will do also without a clinical examination of their abdomen. They are undergoing a teleconsults, or those who want to show reports or discuss about symptoms. We doctors are giving them a video consult over phones and systems, so that their exposure to the hospital is decreased. We also recommend to all antenatal and puerperal mothers to increase their immunity through a good diet, a diet that is rich in vitamin C and fruits and some multiminerals, so that their immunity to combat the disease is increased, because they are a vulnerable sector of the society. So I would suggest that.
Okay, Megha, finally, let's talk about the vaccine story. Do you think one is on the way soon enough, or as many predict, one is not required at all? What is your opinion on this?
No, it is, vaccine is very much going to be in. There are two companies, those vaccines whose vaccines are under the phase 3 trial. In fact, they have started the phase 3 trial on few patients also. We are expecting the vaccine, one of them, to launch its first session in January next year, and maybe the first half of the year. But the question is not only about launching the vaccine, it is like immunizing our country with such a population would take the entire year through. So definitely vaccines are in, and we are eagerly waiting for it.
Okay. Okay. Megha, do you have any closing comments or tips or suggestions for our viewers? If you have anything on your mind, you're free to share.
But I will tell all the viewers that yes, you have to be, don't make it a mania in your mind. It's about COVID. The disease is there. You have to take it intermittently, not very lightly, not psychotic about it. You have to take adequate precautions as is advised by everybody, and please do avoid gatherings. Wearing mask and commenting about people who are wearing masks is not a deal that you have to do. Those who are wearing masks above their noses in public places are actually contributing to you, to your society. So you have to be a part of that group, not the one nowadays. I find people criticizing and laughing at me. Arey, they are fearing government. No, they are not fearing government. They are doing the right thing, and that has to be done. Because if we people do not join hands into all, being together into the precautions of this disease would never be eradicated. It is only the human cooperation that will lead to its end. Do live your normal life, but with all the precautions. That is what I want to say.
Right. True, the COVID-19 pandemic is straining health systems worldwide. Our healthcare employees deserve to be reminded that we recognize the hardships they are facing, the fear that just going to work is bringing them, and no one expects them to sacrifice their own health for our own. So, viewers, let's remember that our doctors and nurses are going through this with amplified challenges just like everyone else. They are our real versions of superheroes now more than ever, but let's not forget that they aren't superhumans. So stay home if not in emergency until that vaccine is out. Thank you. Thank you, Megha, for being with us here today.
Thank you. Thank you, dear. Bye bye.
Bye bye.